All right, welcome to this Rapid Explainer. Today we are looking at something that is an absolute game changer in pediatric medicine. We're spending the next few minutes doing a narrative appraisal of the 2024 International Consensus Criteria for Pediatric Sepsis. And look, this isn't just some minor update to a textbook. This is literally a fundamental rebirth in how we identify life-threatening infections in kids all across the globe. Let's just dive right into it.
So to really grasp this paradigm shift, we kind of have to look at what we're leaving in the rearview mirror. You know the old SIRS criteria? Yeah, that's officially out. And the term severe sepsis? Completely retired. And if you think about it, why wouldn't it be? Sepsis is inherently a life-threatening organ dysfunction. The medical task force basically realized that calling it severe is, well, completely redundant. So out with the old and in with our new standard, the Phoenix Sepsis Score.
And the crazy thing is, this entire new standard, it really hinges on just one single, absolutely crucial number: 2. That's it. Under these new guidelines, if a child with a suspected infection hits a Phoenix Sepsis Score of at least 2 points, well, that definitively identifies life-threatening organ dysfunction. Hitting that 2-point threshold immediately pulls the medical team's focus exactly where it needs to be, right when every single second counts. It's a beautifully simple, integer-based scoring system. It finally moves us away from all those vague, sort of gray area definitions and pushes us into a highly sensitive, purely data-driven model. Basically, by pulling clinical data right from the first 24 hours a patient presents, every single variable is mapped directly to a specific point value. It completely standardizes the diagnosis. Actually, scratch that. It doesn't just standardize it. It completely removes the guesswork from pediatric critical care. Now, you might be thinking, okay, a comprehensive score like this probably needs dozens of inputs, right? Well, no way. The Phoenix score actually restricts its valuation to just 4 core organ systems. We're talking respiratory, cardiovascular, coagulation, and neurological. That is the whole shebang. The task force proved that this streamlined 4-organ model performs just as well as the older, super complex ones. The big takeaway for us here, it drastically cuts down the burden of excessive lab work, which ultimately allows medical teams to act so much faster. And we really have to talk about how cleanly these new criteria operationalize septic shock. Remember, septic shock is a subset of sepsis with a significantly higher mortality risk. Under this system, a child with sepsis only needs to register 1 single point in that cardiovascular subscore. Just 1. So whether that's severe hypotension, or maybe a blood lactate level popping over 5 millimoles per liter, or the need to start vasoactive medications, the trigger is incredibly precise, it's measurable, and it is immediate. But here is where this update becomes truly groundbreaking on a global scale. It's all about built-in redundancy. Think about it. Not every clinic in the world has access to fancy serum lactate tests or advanced vasoactive meds, right? So in lower resource settings, medical staff can simply use low mean arterial blood pressure to calculate that exact same score. It is brilliantly designed to be highly accurate, whether you're standing in a state-of-the-art urban hospital or a remote rural clinic.
So this really brings us to a critical crossroads. I mean, they didn't just call it the Phoenix score for nothing. It really is a symbol of rebirth in critical care guidelines, giving us this highly effective, truly globally applicable tool to identify the absolute sickest children. But the major question we're left with now is this: just how fast will international health networks actually adapt to this new standard? Because the quicker we harmonize this data globally, the faster we can start saving more children's lives worldwide. Thanks so much for joining me for this explainer today, and as always, keep questioning the data.